very much for letting me speak. I'm a little bit nervous. With all due respect, I don't trust anybody in Washington anymore. I think about any kind of bill that increases government control of health care, and it petrifies me. I have been in and out of hospital since I was 17, and 11 years ago I had a heart and liver transplant. My kidneys failed while I was waiting, and I also am on a lot of medication. I go for lab work quite frequently, and I go once a year at the hospital for a checkup. With this kind of plan, I will have to give up my scheduled lab appointments and sit in a DMV-style clinic, taking the day off work so I can get my lab work done every 2 to 3 weeks. Or the government is going to say, hey, you've had too much. Let me send you an end-of-life counselor.
That's very sad.
I have fought too hard for my life, and I refuse to let any government programs diminish my quality of life. I already receive an acceptable standard of service from my healthcare industry. What legally binding guarantees do I have in the healthcare bill under your supervision that would provide acceptable level guarantees?
The same guarantees you have with your private health insurance company now? Except that should be changed. You should be able to, but it would be a way to get under Medicare. Can you sue under Medicare?
No.
But there are appeals, and there's an ombudsman, and the same thing. So talk about red meat to the trial lawyers, who I love, and I used to practice law 16 years. I don't think that would be the best way to go. But right now you're subject to the whim of your private health insurance companies and the private health insurance industry. If your policy ends and they decide to drop you, you have no remedy. None. If they drop you at the end of your policy, you have no remedy. Is your policy for life?
Well, I would say no, and I would give you a plan, but...
Is it for life, or is it simply a year-to-year plan?
Year-to-year.
Yes. At the end of the year, God forbid, and we're so glad you're alive,
Thank you.
they can drop you. And you have no recourse.
What I'm through company policies are family basis.
And the government, I'm not saying it give you more comfort, but at least you can hire and fire the people, at least one of them, who was involved in making the decision. So this, but I understand, I heard your real skepticism and dislike, if you want to go that far. I understand, and I understand that you do.
Person. I'm a web designer. My wife is a photographer. We're both self-employed. We currently purchase our own health insurance because my mother would kill me if we weren't insured, rightly so. And we pay about $560 some a year for our couple, with the $5,000 deductible for each of us. $560 or so for the two of us. We're both in per year. No, per month. And we have a $5,000 deductible per year. So theoretically, we could pay $16,000 before we get any care covered for us. And we went with this plan because it covers everything over a certain rate, and we're hoping to start a family soon. So that seemed reasonable. I don't really have a question, I just have a comment that I think that we're starting out from a point where the system is fatally flawed. It's not, we don't have a system that's working now, we have a system that's very broken. And so I I support the efforts of the President and the Congress in reforming healthcare. I understand that the legislation is still being worked on, so I don't have points to nitpick because I know that it's not there yet. I just want you to know, as you take the pulse of your constituents, that I support the reform. I think it's important to have a mandate. I think it's very important to have a public plan. My sister has gone through bankruptcy, partially related to healthcare expenses, and so I just wanted to encourage you to continue to work towards reforming healthcare, getting a general mandate, and getting a public option, which will help with so many things and create competition, just helping them to thrive. I'm a part of the segment of the population that is covered. I'm not part of the 47 million that's not. I am covered, but I'm unhappy with my situation. So I don't think it's easy to say that there are all the people who are covered who are for the current system and all the people who are uninsured who are for a new system. I'm covered. I want a new system. It's fatally broken and it needs to be fixed. If I were to, as a self-employed person, I need to start taking on employees, that the cost of health insurance is just prohibitive of offering that to people. It's very prohibitive for my wife and I to pay $16,000 a year before any coverage is paid. And knowing that there are all kinds of inefficiencies in the systems because there's a monopoly, because there just are not options. I'm currently employed through the Freelancers Union, which is an organization in New York City that allows freelancers to buy into a group plan. That's the only plan that I could find that was under $600, and I still have a $5,000 deductible. That they no longer offer that in New Jersey. So if they stop offering that to me, I have to go back into the regular pool, pay over $1,000, and it's ridiculous.
Thank you very much. Just get to the mic.
Yeah, I just would like to make a comment regarding where we're going. You had mentioned earlier, and I appreciate your comments, and I resonate with many of the things that you said. I'm a union member, a third-generation member of the United Brotherhood of Carpenters. My father, who retired as a carpenter many years ago, when he retired, he was covered from the day he left the trade until the day he died. He was covered for all his health care. Those were the good old days, post-World War II. And even though my wages and the wages of my brothers and sisters in the trades has essentially stagnated over time, the more and more of our health care costs are going continually up, as you had also noted. And in my current plan that I have now, I have a $10 copay, which I didn't have before. And I just had my knees replaced, and I received a bill from my insurance company decided to pay my anesthesiologist for the services rendered, which I appreciate because I'm here speaking about it. Paid them $4,000, and then the anesthesiologist sent me a bill for the additional $3,000, which I will, of course, pay if I need to. I'm trying to redress that imbalance with my insurance company, but my point is that something needs to be done. As time goes on, we just can't wait, because we can say that things won't change, but things do change, whether we like it or not. So we need to be proactive. We need to take the moment that struck. We have this new president. We have the opportunity now to do something that should have been done many years ago. And free rest needs to be taken so that every American is secure and having health care. Thank you very much.